Good morning and welcome to Apollo 24/7's Health Hour. Health Hour is a show where we bring in Apollo 24/7's experts every week to this live show. You can ask all your questions and queries you want to ask, and in case you have a question to be asked, come on to YouTube chat box where you can type your question. You must be watching this episode on Facebook pages as well, but in case you have a query to be answered, please do type it on YouTube chat box only. And while you're typing your question, a sincere request to all our audiences that please do type your age, gender, all the questions possible in one chat only, because it helps me to place the question before the expert so that they can answer it for you. And it's good to see you all. I urge you all to download Apollo 24/7 app where you can bring the entire Apollo services just to your phone, and then you can conveniently order medicines, book tests and also consult online. चलिए आज के बारे में बात करते हैं जहां हम स्ट्रेस एंड डायबिटीज के बारे में बात करने वाले हैं। क्या डायबिटीज स्ट्रेस की वजह से हो सकता है, या डज stress increase diabetes chances, or is diabetes going to affect your stress levels in any way? What is the connection between all of these, and how do you effectively manage diabetes on a long run while managing your stress levels as well? To answer all your questions, we are going to bring in our Apollo's expert, general physician, internal medicine, Dr. Madhusudhan Reddy ji from Apollo Hospitals, Jubilee Hills, Hyderabad. He's going to join us in a few minutes. Also on this show, you have a chance of winning prizes if you participate in health quiz. So Dr. Saab ko aap dhyan se suniyega. Please listen to him carefully because you might get your answers, the clues for the questions that I'm going to ask on this show. So let's meet our expert for today, Dr. Madhusudhan Reddy L, who is a general physician consultant, internal medicine, Apollo Hospitals, Jubilee Hills, Hyderabad, with experience more than 11 plus years. And Dr. Madhusudhan Reddy ji can be consulted for diabetes, hypertension, dyslipidemia, cold, cough, fever, COVID-19, thyroid disorders, preventive health, medical emergencies, and also infectious diseases. And here we invite Dr. Madhusudhan Reddy garu. Namaskaram. Good morning.
Yeah, good morning, Abhijit Jansi garu. Yeah, thank you for having me on the show. Yeah, yes. Good morning,
Wonderful,
everyone.
Dr. Garu. Thank you so much. We have lovely audience who joins us every week on this show across the country. We have north,
Okay.
south, east, west, all audience joining in. So we predominantly keep the show in English so that everybody will understand. Also, कभी कभी हिंदी में अगर क्वेश्चन आते हैं तो मैं क्वेश्चन हिंदी में भी ले लूंगी. And because our Dr. Saab can speak Telugu, and both Telangana and AP, you can also ask your questions in Telugu. So chaliye, let's meet and start our discussion for today. Dr. Madhusudhan Reddy garu, wonderful having you here. So we might have
Yeah,
stressed you
thank
on a
you.
Sunday morning. We
Yeah,
must have added a bit more onto your Sunday stress by asking you to be here, but we appreciate your time and thank you
nice.
so much for.
Yeah,
So
thank you.
yeah.
Yeah,
While I was asking, I was introducing you, I was saying that stress does play a role in diabetes. Am I right?
yes.
Can stress cause diabetes in any which way?
Yeah, so let us understand what the stress is really. So, stress is a normal body, how our body responds to any new situation or a difficult situation. So, I'll
Ji.
put it in a simple words. So, what happens during stress is the body reacts in such a way that there are many hormones released to counter that stress. So,
Acha.
all these hormones, what they do is they prepare our body to fight for the situation. So most of these hormones cause a rise in the blood glucose levels. So there is only one hormone to counteract all these changes in the body, that is insulin. So what happens during stress is there is rise in the blood glucose levels in the body. So which makes patients who are predisposed or have a predisposition for diabetes, or people who are diabetic already, for them these hormones make harder for insulin to work on the body. So that is how all these hormones cause a rise in the blood glucose levels and make control of diabetes a little more harder to treat along with medicines.
Wow.
So
So
patient, yeah.
it is first and foremost very important to manage your stress so that you don't get to the point where you are declared diabetes.
Yes. So this is the most neglected part. People don't for most of the times they don't accept even they are in stress, and this is a neglected part in the treatment of diabetes. So in spite of many drugs people are on, they follow all the things, but still the diabetes will not be under control. So one of the things we need to rule out is the stress factor, which might be very subtle in some patients, but playing a major role. So identifying stress in them is very important. And once we remove that stress or some how we help them in coping up with the stress, will help a lot in the management of diabetes for the individual.
Wonderful. So while we are talking about, stress is something which could be acute or chronic or immediate, or,
Yes.
duration is not in our control. But I want to understand, if it is a stress induced pre-diabetes or stress induced insulin resistance or stress induced diabetes, can I manage this? Can it be reversed?
So definitely, see, we need to identify the root cause for the stress. So unless we identify and treat it, we can't have a proper management plan for diabetes. So we need to identify the root cause and treat the stress. That itself might help people in coming back to normal levels of sugars, or people in well controlled who are on well controlled recently got shifted to uncontrolled diabetes. The just removing the stress factor can help play a very important role in the treatment.
Okay, okay.
So
So
main thing
thank you,
is
Dr.
accepting the feeling.
Garu. Yeah, our audience have started to join in. There might
Yes.
be questions regarding diabetes management and other correlated diseases along with diabetes. So I request all our audience to kindly type in their questions. Now we are ready to take questions. Your questions will be taken up, and we'll be posing your questions before Dr. Madhusudhan Reddy Garu, and he will be answering your questions. Also, last week, health quiz winners, you have to send in your details, like, phone numbers, email IDs, and other contact, complete name, and all other details by Wednesday to claim your prizes to marketing at apollo247.com. All the details are running on a ticker. If you have been announced as a winner last week and if you have not claimed, this is your last chance to claim, and please do send in your details. All right. So, Dr. Garu, one quick question before I see Nirmal
Yes.
and Chinku. All of these have started to ask their questions. I'm taking your questions
Yeah,
in
you
2 minutes,
got it.
Nirmal and Panditji. Chiku Panditji. Sir, how will I understand that कि ये डायबिटीज के कोई लक्षण होते हैं क्या, or at least pre-diabetes के lot of people don't even know that they're heading towards diabetes. It's not a disease per se, right? So what could be the
Yes.
basic understanding symptoms that one can think I am heading towards diabetes?
See, diabetes is a very complex disease. So by the time we identify the symptoms, so it would have been a long time before the diabetes has set in the body. So, see, main thing is prevention. There is a lot of incidents in the country. So the main thing is prevention, which can the by the time we identify symptoms in a patient, that would have been a long time before the diabetes has set in a particular person. So the main thing is to screen the patients. So people who are having the risk factors, they should have the regularly screened for the diabetes from the age of 30. So it's better to screen all the
Sir,
patients who
so
have the
what are the
particular
risk
risk
factors?
factors.
What
Yeah,
are the
like
risk factors?
obesity. So overweight, if
Okay.
their BMI is more than 25, or if they have a family history of diabetes, or patients who are on certain medications which might predispose to diabetes, all these patients, they need to be screened regularly. So starting at the age of 30, and once in every 1 or 2 years they should be screened for diabetes. That is how we can identify diabetes at a very early stage. So by the time symptomatic identification is probably by the time it would have been there in the body for a very long time, by the time the
Oh,
symptoms set in.
fatigue.
So unless,
One of my very young colleague who was working as a producer with me on one of the television channels, very young fellow, around 28, under 30-year-old. He was complaining
yes,
stress, fatigue, losing weight, always thirsty, always in the frequent urination, and we never, while knowing everything that he's a very young boy, we never suspected that it could be diabetes. We
yeah,
we
these are the
ignored it for
patients.
so long.
So we call these are hyperglycemic symptoms. So people with high blood sugar, especially type 1 diabetes, they can present with the symptoms, particularly like polyuria means they will have frequent urination, high frequent feeling thirsty, and they have this all hyperglycemic system, blurring of the vision, excessive fatigue, weight loss. These are some of the symptoms for especially patient with type 1 diabetes. They even present with first time presentation might be with a medical emergency with high blood sugars. So these are
Wow.
the patients, yeah, the type 1 patients especially they present with symptoms. So for
But which
type
is the
2, it is
most common
yes,
is which of the diabetes is most common, sir?
yeah, most common is type 2 diabetes, which is more common. So for
Okay.
this type 2, usually they don't present with symptoms. So mainly it is the screening which can pick up more number of patients rather than the symptomatic uh,
All right.
diagnosis.
All right. Dr. Garu, while we are talking about diabetes and we are giving information which is very important, I will also want to take up
Yeah.
audience's questions, which will be their personal questions. But while you're answering personal questions of one person, it is information for a lot of patients too. So let me start
Yes.
questions from the YouTube. First question that I would want to ask is Srinivas Nandula. Srinivas garu em adugutunnarante, if due to stress, sugar levels go up, what can I do?
శ్రీనివాస్ సార్ యా సో మీరు ఆల్రెడీ మెడిసిన్స్ పైన ఉంటే కన్నా సే వెదర్ ఐ డోంట్ నో వెదర్ యూఆర్ ఆన్ మెడిసిన్స్ ఆర్ నాట్ ఇఫ్ యూఆర్ ఆల్రెడీ ఆన్ మెడిసిన్స్ సో యూ షుడ్ ఐడెంటిఫై ఇఫ్ దర్ ఈస్ అన్ అన్కంట్రోల్డ్ షుగర్స్ ఈవెన్ విత్ మెడిసిన్స్ then if you don't find any other cause probably you need to rule out stress is one of the cause for diabetes. Just cross check your own symptoms, or if you have any stressors in your life, just cross check, just question yourself. If there is no identifiable cause, then you need to seek a medical attention. So usually the stress might be the important factor uh, causing our sugars go uncontrolled.
Yeah. So first manage your stress is what Dr. Madhusudhan Reddy garu
Yeah,
is giving you. So identify
yeah,
మీ స్ట్రెస్ కారణాలు ఏంటో మీరు
yes,
కనుక్కోండి, ఆ తర్వాత వాటిని ఫస్ట్ మేనేజ్ చేయండి. దాంతో సరిపోతుందంటారా సార్? బట్
yes,
ఇది కూడా చూసుకుంటూ ఉండాలి. ఏది డయాబెటీస్ ఉందా లేదా, ప్రీ
yeah,
డయాబెటీస్ లో ఉన్నారు, ఏం టెస్ట్లు,
yeah,
వాట్ ఆర్
that
ద
is
టెస్ట్
more
దట్ యు?
important. So if they have a risk factor or they have think stress is the cause for diabetes, they're just basic tests like fasting blood glucose, we call it as oral glucose tolerance test. This is a test which can identify at a very early stage patient who are even the pre-diabetes stage it can pick up. And one of the test is the HbA1c test which can pick up diabetes. So there is a
Okay.
pre-diabetes stage also. That is also so some patients can have a normal HbA1c levels, but high fasting glucose levels. These patients we call it as impaired fasting glucose. Patients can have normal fasting sugar and also normal HbA1c, but their oral glucose tolerance test might be abnormal. For them, we call it as
Oh,
glucose intolerance. So these are the two things which can be picked up early, and these are the stages which we can reverse the diabetes
and
if we
dear
pick
audience,
up
as
very
you
early.
all know, yeah, Apollo 24/7 offers you all these tests. Download the app and get your tests done on the right time. And Dr. Madhusudhan Reddy ji can be consulted on Apollo 24/7 as well. The link to consult him is also given in the chat box. Well, Dr. Garu, here's another question. Nirmal Raul 77. Nirmal ji is asking, is cholesterol and diabetes, are these two correlated?
Nirmal garu, yeah, they are definitely correlated. So diabetes can be a cause of dyslipidemia, or dyslipidemia itself can cause diabetes. Both are interlinked. Okay, so managing both is very important. The first we need to start with the lifestyle modifications. If they don't work and if you are not very compliant with the lifestyle modifications, then you need to go for medications. But these medications play a very minor role. Definitely, it is a lifestyle which has to be regularized.
Yeah.
So definitely they have
Lifestyle
a clear,
is,
yeah,
yeah, yeah.
very
Please
important
continue,
role.
doctor.
Yeah, lifestyle is modification plays a very important role. Medications can only help unless you are strict with your lifestyle. These don't work that much. So it is main the lifestyle modifications which help a lot. Even the medications for them to work, it's the lifestyle which has to be changed because they only decrease the insulin resistance, not or increase the insulin. But unless you do a lifestyle modification, this insulin resistance will not come down. That's the main important thing in the treatment of diabetes. Unless you change your lifestyle, these medications will
Will
only
not.
help to a certain extent. Yeah.
Yeah. So yes, I've seen wonderful, miraculous turnaround cases when they've changed their lifestyle.
Yes. Yes.
When
Yeah.
small changes that they've altered, we've seen beautiful stories and such positive stories. We've seen. We'll share them in
Yes.
a bit.
Yes.
Now,
This should be
my
a very
next
important
question is
topic.
from yes, doctor Chiku Panditji is asking, sir, can we treat diabetes not for only control to finish it? Okay, let me understand this question. I suppose can we only treat diabetes or can we finish it in the sense can we reverse it? ये खत्म कभी होता है क्या?
Yeah, see, reversal is a misnomer actually. So, yeah, Mr. Chiku, right? Chiku, yeah.
Chiku.
So, yeah, Mr. Chiku, reversal is a misnomer because it's not a permanent thing. So, it is reversible either way. So, patient can come to normal and they can again go to a diabetes stage. So people, there are many studies who are initially picked up like in people in pre-diabetes stage. For them, there is a strict lifestyle modification and drugs like metformin. If they are started early, there are few cases which are reversed. Reversed in the sense, so when we call it as reversal is patients maintain their normal glucose levels without any medication. That is when we call it as reversal for a significant amount of time. So without medication, if they maintain a normal blood glucose levels in a patient with pre-diabetes or diabetes, that is when we call it as reversal. So it can be reversed at a very early stage of pre-diabetes stage. That is the best stage we can avoid prevention of diabetes can happen. But still, it is
Okay.
reversible in either way. Yeah.
All right, doctor. Thank you so much for answering it because this is always a question of debate and a lot of,
Yes.
there are alternate medicine practitioners who always claim to say that they've reversed
Sure.
diabetes, and there's an entire debate we can discuss where 2 3 hours we can sit and discuss.
There is a
Next
concept
question.
of reversal, but it's not permanent. Yeah. That much they should understand.
All right, doctor. Next question is Aviroop Sen Gupta. Does weight loss occur for the first 2 months while on diabetes medication?
Yeah, Andrew. There are some medications which help you to lose some weight. There are some medications in the diabetic management which help you to lose weight. As such, if there is no reason for your weight loss, definitely diabetes is one of the reason, or uncontrolled diabetes can itself cause some weight loss. So weight loss thing we need to see it in a very clear picture because uncontrolled diabetes itself can cause some weight loss. So even
Okay.
the diabetes medications, some medications we put patients on diabetic medications which help them to lose some weight. So definitely, diabetes medications, if they're started on treatment, there is a chance of losing some weight. There are complaint with the medication and lifestyle modification. That is, medicines can help in losing some weight. As such, the other side is if you are losing weight, if there is no reason and there is uncontrolled sugars, then the uncontrolled sugar itself is the cause for your weight loss. Those two things we need to identify clearly.
Wow, this is like a vicious cycle. One thing
Yes,
can
yes.
trigger something, and that trigger can
Yes,
cause
this will
something,
not
and the
trigger.
cause can
Weight
trigger
loss.
the.
Yeah. Weight loss will not trigger diabetes, but uncontrolled diabetes can cause weight loss.
Yeah, weight gain can trigger
Yeah,
diabetes.
weight gain can trigger diabetes. That's true. Weight gain can
Ah,
trigger diabetes, but weight loss can be because of two reasons. So even uncontrolled sugars can might cause weight loss.
okay, okay. So that's a very important point that Dr. Madhusudhan Reddy has given us. So next question is from Mr. Ram Dular Vishwakarma, 61-year-old male. At what level of HbA1c one must start the medication? And I want to understand at a personal level कि HbA1c from my last understanding कि pre-diabetic के HbA1c and then somebody who is existing diabetes HbA1c. How do we understand these numbers?
Yeah, Mr. Ram, yeah, I understand your question. So I think at what initially when you are diagnosed with diabetes, so for them HbA1c 6.5 is the cutoff for diagnosing a diabetes. So, so diabetes is a very individualized treatment is very individualized. We can't say this is the level where should start treatment. So that doesn't happen. It is very individualized. We see the patient, how is their lifestyle, how is their body composition. So these are all the factors which we take into control before starting medications. So people who are not overweight, people who have a strict lifestyle, and people who are very compliant with the lifestyle, for them probably see, we can wait till 6.5. Or people who are obese, people who have very all other risk factors, for them we start medication even before 6.5 pre-diabetes range itself, so that they can lose some weight and we can prevent the diabetes. So it's a very individual treatment. By going by general consideration, it is cutoff value will be the 6.5, and 7 we usually start treatment. Till 6.57 we usually ask the patient to control diabetes with their lifestyle modifications, diet and exercise. We counsel them for that, but people who are not compliant with those things, definitely we need that to be gone to the medication, because thing what we do in diabetes is we need to prevent the complications. That is more important thing. You just can't wait
Yeah.
till the sugars come normal with all these interventions. Yeah.
So let me also,
So
if it helps, I, at a point of time, while being very active, while being healthy with my lifestyle, stress has put me to a pre-diabetic zone. I was 6.5 at a point of time when my HbA1c levels shot up. So that's when we understood that it is stress that is acting on me while being very active, controlled, no
yes,
other reasons. So then I worked out, I managed myself, and I'm now back. So this
yeah,
is my
good.
story in case somebody wants to
Yeah,
take a positive charge from it.
yeah, inspiring. Yeah. So
Yes,
definitely, yeah, once you remove that stress, so it's the most neglected part of the treatment. So people will not spend time with the doctor. They don't explain their concerns properly. So and they'll be regular with their medications and everything. But this is the most neglected part. Unless they express themselves with the doctor or a family member, this can't be identified and acted upon on the right time.
yeah, I was blind. I
So
was thinking I'm fine. I'm like not overweight. I'm not exercising regularly. I'm doing everything that can be. I'm not good. I'm very good with my food choices, but yet I wasn't
yes,
sleeping well. I had a constant stressor, and that increased. Suddenly, one of my regular blood tests showed HbA1c, which was 6.5. That's the
yes.
moment of realization, and we got everything back into control.
Good, good. So the
Thank you,
other thing
Doctor.
is another component is there, which is diabetes distress. So patient who is already on medication for diabetes, so who are newly diagnosed, who are not properly educated with the diabetes. These are the people who have this diabetes distress component called diabetes distress. So that is a new thing
Okay.
in their life. They don't know how to manage diabetes, new drugs, new diet plans. People who are feared about their sugars getting low. So these even this can contribute to diabetes. Diabetes itself can contribute to stress. So these are the concerns which should be answered at a very early stage. Yeah. So
Yeah,
patient
and
education about the diabetes. Yeah. You
counseling
continue.
must be playing a very important role.
Yeah, at least in the patients who are diagnosed newly, they should be fully educated about the diabetes, their medications. So that plays a very important role, because diabetes itself can contribute that stress further. So it's a vicious
Yes, Doctor.
circle. Yeah.
Yeah. Dr. Madhusudhan Garu, while you were talking a little while ago, you were saying about complications which arise out of diabetes.
Yeah.
Here's a question that I would want to take up from the audience. Mr. Debatam Roy, my dad has diabetes since last 15 years and he had a stroke last month. How do I manage his diabetes now?
Yeah, Mr. Rice, I need to completely understand what the medications is he on and what the sugar levels are. But it's okay. I think once he has developed the complications, so the main thing what we can do is a control of diabetes. That is more important to prevent further complications. So the stroke itself is one of the complications, a cardiovascular complication. So at this stage, the more important thing is to control the blood sugar levels. At least now, it should be properly managed. If he they can give me the complete list of medications or consult your doctor. So how is your blood glucose levels? How are they controlled? What are the medications is he on? What are other complications he is likely to develop in future? You should be screened for other complications. So if they are screened properly and identified at an early stage, this can be prevented further.
Okay.
So he
So
needs to consult.
monitoring, according to what you've said, Dr. Saab can be consulted, by the way, Mr. Debatam Roy. He can be consulted on Apollo 24/7. Sir ka link bhi diya
Yes.
hua hai for details. He can be
Yeah. Yeah.
consulted
They
because
can
this
consult.
is not a platform. Yeah, but to give awareness, Doctor, while you were talking about how one has to keep managing their levels, and how what are the intervals that one has to check their blood sugars, and how can they check their blood sugars?
Yeah, so say diabetes self-management is very important. Say that's a patient involvement is the main thing in the treatment of diabetes. Unless they involve in the treatment, so it can't be a complete treatment. So they should regularly people who are on insulin or who are recently changed on their medication or their recent change in their lifestyle or they have developed any new complication or new infection or something. These are the people who needs to be monitored carefully at home. At least they should monitor their blood glucose levels with a glucometer at home. So make down all the readings, make note of all the readings, and if they are well educated enough about the diabetes, so doctor will explain them how to adjust their insulin. If they are not good at it, they can consult the doctor with all the readings. They can help out with that. So those are the people
Yeah.
who need to be monitor their glucose at home. Self management is
Oh,
very important. People on regular insulin, they should check their glucose levels at least once in every 4 days. People who wants to change their dose or who are already on insulin, whenever there is a new intervention or new change in lifestyle or their anticipated change in their diet plan, that is when they should monitor the blood glucose at home. Or for
yeah.
regular screening, once in 3 months is fine.
Oh, okay, doctor. So the simplest glucometer can be ordered from Apollo 24/7 as well. They do have a lot of other the things that you can order from. Mr. Debashish Mukherjee, I would want to take your question next, but आपने age and diabetes के levels कुछ आपने यहाँ पर लिखा नहीं है. We would appreciate if you can quickly type her age, how long she has been diabetic for, and is she type 1, type 2, insulin dependent, or all these details, because diabetes is something which Dr. Saab will require a lot of questions. The simple question that he has asked is, my wife is diabetic, why do we have to increase the dosage of medicines? So dosage तो एक बार अगर किसी ने बता दिया कि ये डोज है तो वो लाइफ लॉन्ग सेम डोज, आई डोंट थिंक दैट्स द सेम डोज दैट वन हैज टू स्टिक टू. Why is it
Yes.
important to monitor dosage?
Yes, see, once we start treatment, we put on lot of interventions on the patient, like life change in the diet, change in the lifestyle, and we add some medications. So all these play a role in the controlling your sugar levels. So we need to regularly monitor your sugar levels. If because we only start a low dose patients which are for basing on the body weight and sugar levels, we start a dose and patients will be compliant with the diet. Some will not be on the compliant with the diet or lifestyle modifications, and some patients will not be compliant with the medications itself. So people who are compliant also we need to adjust the medications till their sugar levels are under control. So that happens with time. So with time we slowly titrate the dosages, and then once the sugar levels are controlled, that is when we monitor not that closely. But initially there will be some changes in the dose depending on their sugar levels. It might be increased or we might decrease for patients who are well controlled, who are strict with their lifestyle. We might decrease the dose also. So either way it happens.
Yeah, Mr. Devashish has replied here. The age of the patient is 65, and she's been diabetic for last 3 years.
Okay. So what are the medications? Did you type medication history?
Devashish ji, can you also please
It's okay,
type the
fine.
medication? All right.
Yeah,
So,
that is the reason
Dr.
we
Pai,
change the dosages.
yeah, the reason for changing dosage is that, so don't blindly follow the prescription like this old prescriptions लेके बैठो मत. Don't marry yourself to one old prescription or one old report, is what I keep telling everybody. Your doctor
Yes.
needs to be your best friend. So continue
Yes.
your consultations with your doctor. Keep going back to your doctors. And diabetes is not just one time touch and go consultation ki ho gaya bas, I'm not going to see you. Your patients become your friends, doctor.
Yes, definitely. Have a lot of patients. I remember by their names, faces. I don't even see the slips at all.
Profile be, I know, because this is a long term, we need to
Now we establish
go hand in
relationship
hand.
once we are diabetic.
Yeah. So Debashish Mukherjee's wife is having metformin 500 twice a day.
Okay, I think that's a very diabetes is the one, metformin is the drug which we start what first medications which we start on the patient. So 500 mg twice a dose is a mild dose. Probably if the sugars are well controlled, she can continue with the dose. But depending on the sugar levels, if it is not under control, definitely we need to increase the dose or shift to another medication.
Yeah. Now 1,000 a day,
Yeah,
twice a
1000
day. They
yeah.
it. Yeah.
It's a moderate
So
dose. Yeah. Yes. So it will help
okay.
in weight reduction. Yeah.
All right. So after this, also, if it isn't being managed, then they will still think of changing the drug or changing the
Yes.
dosage.
Yeah. Change the
All
dose
right.
or add a new drug which has a different mechanism.
Here's a very important discussion that we need to make with the newer generation, young generation workforce. Indus Bharat is asking this question. Indus is asking, poor sleep due to my irregular shift duties. Can this result in diabetes in future? Sir, we are at a generation, Dr. Madhusudhan Garu, where our
Yeah.
entire half of the population is working in the night. Half of the population doesn't sleep because of the gadgets, parties, or whatever. So, how do we help our next generation?
So definitely a good healthy quality sleep is very important for control of the diabetes or uh, patients not developing diabetes. So a healthy quality sleep is very essential. At least a minimum 6 hours of sleep and not more than 8 hours of sleep. So either way it's harmful. So 6 to 8 hours of sleep, quality sleep is very much essential. So people on
How about
night
people who are
shifts.
working in the night shifts? Yeah, both of us are saying the
Yeah,
same
so
thing.
with time, yeah. So it really difficult for them. So they have to try to cope up with other things, with other lifestyle modifications like regular exercise. So whatever they can have time, just they should have a good quality of sleep and maintain very healthy lifestyle like diet and regular exercise. That might help in maintaining a healthy lifestyle apart from sleep. So
Yeah,
anyhow,
but are
whatever
there
it is, yeah. So
are
definitely,
these
yeah. If they do.
yeah, sorry. I think there's an overlap happening and we're overlapping each other, but we will give 2 seconds or 3 seconds for each one to complete. My question was, are such group of people who are working night shifts and uncontrolled stress are prone to diabetes in future?
So definitely, they should be very careful if they have undue stress or because of their lack of sleep. If they have stress, definitely these are the people who need to be careful, and they should have other lifestyle modifications like maintain a healthy diet and at least a brisk walk of 30 minutes a day, 5 days a week. If they have very sedentary lifestyle, at least of not more than 30 minutes of sitting. At least they should break their sitting for at least after 30 minutes. Have a brisk walk for 5 minutes, and come down and sit. At least these the small things can help in a very long way.
Wonderful, doctor. Thank you. Ramakrishna Kishore Garu from 60-year-old from Vijayawada. I'm diabetic for last 25 years. Diabetes is in control, but burning sensation in feet. ఎందుకు ఇలా జరుగుతుంది అని అడుగుతున్నారు రామకృష్ణ గారి కోసం we will answer this question in Telugu for Mr. Ramakrishna, and because it is an important question we will later translate it into English and Hindi for your sake. Dr. Garu,
Yeah.
please go ahead.
రామకృష్ణ గారు నమస్తే అండి. ఇది మీ షుగర్ లాస్ట్ 25 years నుంచి ఉందంటున్నారు కాబట్టి సో న్యూరోపతి అనేది ఒక కాంప్లికేషన్ డయాబెటీస్ వన్ ఆఫ్ ద కాంప్లికేషన్ అది న్యూరోపతి అంటే ప్రొలాంగ్డ్ చాలా రోజుల నుంచి మీకు ఆల్మోస్ట్ 25 years నుంచి డయాబెటీస్ ఉందంటున్నారు కాబట్టి సో యు ఆర్ డెఫినెట్లీ ప్రోన్ టు గెట్ న్యూరోపతి. మన నర్వ్స్ ఎఫెక్ట్ అవుతాయి ఇఫ్ ద చాలా రోజులు బట్టి మీకు షుగర్ ఉండడం వల్ల మీ నర్వ్స్ అనేటివి ఎఫెక్ట్ అవుతాయి. దానికి ట్రీట్మెంట్ షుగర్స్ కంట్రోల్ చేసుకోవడము, దాంతోపాటు మీ సిమ్టమ్స్ని రిలీవ్ చేయడానికి కొన్ని మెడికేషన్స్ ఉన్నాయి. యూ కెన్ కన్సల్ట్ యువర్ డాక్టర్ అండ్ టేక్ దోస్ మెడికేషన్స్. ఒకటే మెయిన్ ఇంపార్టెంట్ థింగ్ ఏంటంటే కంట్రోల్ ఆఫ్ డయాబెటీస్ వాట్ ఎవర్ అట్లీస్ట్ ఫర్దర్గా ప్రోగ్రెస్ కాకుండా హెల్ప్ చేయడానికి గుడ్ కంట్రోల్ ఆఫ్ డయాబెటీస్ అనేది చాలా ముఖ్యం. So
Yeah.
this is
Quickly, I'll
peripheral
do the same
neuropathy.
thing. या I'll repeat whatever डॉक्टर साहब has said in हिंदी. जिनको डायबिटीज है वो काफी लंबे समय से अगर डायबिटीज किसी को है तो वो डायबिटिस न्यूरोपैथी के बारे में भी जानना बहुत इंपॉर्टेंट है. आपके जो फीट के अंदर जो नर्व्स जाते हैं उनमें डायबिटिस न्यूरोपैथी हो सकता है जिसके वजह से बर्निंग सेंसेशन या जलना, पैरों में जलना हो सकता है. तो आपको पहली बार डायबिटीज को कंट्रोल में लगाना पड़ेगा. उसके बाद कंसल्ट कीजिए आपके फिजिशियन को जो ये जो न्यूरोपैथी के मेडिसिन स्पेसिफिकली डायबिटीज पेशेंट्स को दे सकते हैं. डॉक्टर गर्ग प्लीज कंटिन्यू.
Yeah, one more thing is important is all the patients with peripheral neuropathy, so they should keep their feet very clean without any wounds. That is more important. So once the
No
peripheral
wound,
neuropathy sets in, yeah,
not even a small cut. Very, very importantly,
yes,
we have to
yeah.
stress.
So
Even a small
they
cut
should
can cause major damage.
Yeah, so they should keep checking their web spaces. They should keep their food clean because they don't sense the pain as normal people. Even if they have some prick or some injury, they don't feel it
The
as
pain.
abnormal. Yeah, they don't
Right.
feel the pain. So that is the one of the reasons for the wound to spread very fast. And even in patients with diabetes, the wound healing is not that good. So better to prevent the wound, keep your feet clean and wear proper foot protective footwear. Okay, that is more
Wonderful, sir.
important. Yeah.
डायबिटीज में सबसे ज्यादा आपके फूट का ख्याल, पैरों का ख्याल रखिए. और आप क्योंकि आपको पेन का सेंसेशन होता नहीं है फीट में, आपको आपके फीट को बहुत अच्छी तरह से संभाल के रखना पड़ेगा. सही ढंग के फुटवेयर पहनिएगा और बार बार अपने फीट को चेक कीजिएगा. दैट्स व्हाट डॉक्टर साहब ने आपको एडवाइस दिया है. सो नेक्स्ट क्वेश्चन इज मिस्टर मोहन कृष्ण's क्वेश्चन. 29-year-old, type 2 diabetes since last 4 years, HbA1c is 7.1, and he's on metformin twice a day, 500. I've lost around 8 kilos of weight. Can I gain my weight back?
Srinivas, garu, is it
Mohan
Srinivas?
Krishna.
Mr. Mohan Krishna. Yeah, Mr.
Mohan.
Mohan Krishna. So first I need to know, was it intentional or unintentional weight loss? So that is important thing.
Mohan, you have to please
Okay.
type it was intentionally that you lost weight or due to medications or, while managing diabetes, you lost weight. Yeah,
So,
while he types, please.
yeah, seeing by numbers, probably it is a well-controlled diabetes, well-controlled diabetes. So if he maintains a well-balanced diet with a dietitian consultation, probably he should pick up on his weight if his BMI is very low. So more important thing is the BMI. So how much BMI is he, or if he is lost intentionally, then it's a good thing because it helps in the control of diabetes. But it is unintentional weight loss, then we need to find out the other reasons for the weight loss. That is more important thing. So if it is unintentional and if you continue to lose weight, please consult your doctor. If it is intentional and if that means your control glucose is under well controlled, and your BMI is more important.
Yeah,
So
yeah.
if there is no reason for it, consult a good dietitian, improve your diet. That should help in maintaining your body weight properly. So
Yes,
just finding out the reason is more important.
wonderful. Do not fear, you will be back on track.
Yeah.
Rakshak is asking next question. Do taking steroids lead to type 1 diabetic condition? And I think COVID has brought up this question into forefront and
Okay.
limelight.
Yeah.
Doctor?
Yes, yes. So I think Rakshit is asking about type 1. I think
Yes, type 1
steroids,
diabetic.
steroid doesn't cause any type 1 diabetes. So the pathophysiology behind type 1 diabetes is entirely different compared to type 2. So probably steroids can trigger type 2 diabetes in patients who are already predisposed or have a predisposition for diabetes, or people who are on pre-diabetes stage. That steroids can push them to a full-blown diabetes, or people who are already on with diabetes on medication. They can have an uncontrolled sugars during treatment with steroids. Definitely, steroids can alter your sugar levels. So if it is a temporary thing, probably you consult your doctor, change your medication. If you have to take it for a long time, then so you need to there need to be adjustment in the medications, and you should get monitored for your complications for both diabetes and steroid use.
All right. Surya Prakash Rao Garu, can you please type all your questions into one chat box? Can you please copy paste everything because you're asking me in bits and pieces? I will not be able to put your question before Doctor. Surya Prakash Garu, I request you once again to type every detail into one question, please. And in the meanwhile, Mishti, you also have to add your age, your how long you've been diabetic for, and gender and other questions because you just have texted your dosage of medications. Dr. Next and very important question. Sean David J is asking this question. Muscle wastage, 65-year-old male, diabetic, and does diabetes also call muscle loss along with losing of weight?
Yes, definitely. We call it as sarcopenia. So diabetes can cause sarcopenia, and as such, elderly people with they are prone to get this sarcopenia. So for him, I think probably is a 65-year-old. So both might be
Right.
contributing for his, yeah, for his muscle loss. So we should see a doctor. If there is significant sarcopenia, definitely there should be a change in diet or medication, and some at least some exercises that might build resistance in the muscles, and that might help to even improve the muscle strength. Those are things which can help you in reversing in managing the sarcopenia. So there are different causes. Both can cause sarcopenia. So even uncontrolled diabetes and as such age can lead to sarcopenia. The main important thing is have a good diet and some physical therapy which should uh, help in increasing the resistance in the muscles and muscle buildup and diet.
Yeah. Right. So while we talk about muscle and while we talk about being active, we don't look at the importance of building up muscle or doing exercises for muscle or
Yeah.
eating food, especially for we're all scared of protein. We're all scared of diabetes है तो sweet से दूर रखते हैं. But then while you're talking about diet and diabetes, there's so much gap, doctor. What is your valuable advice for our patients who would want to maintain good nutrition?
See, protein is very important for the muscle and the rest of the body build-up. The muscle protein is very important. So, anything in moderation is very good for the body. So, don't take it in excess. So, people go to gyms and take so many protein supplements. Those are that should be taken under professional
Yeah.
supervision. Or unless the moderation in moderation, protein is definitely helpful. See to it that your diet plan includes a good amount of protein in your diet. There are some conditions where you should avoid excess protein. So if you consult your doctor, they definitely help you out with your diet plan. Otherwise, normal patients who are on well-controlled diabetes, they should have a good portion of their meal with protein.
Yes, doctor. Here's the next question from a registered user question. Can diabetes lead to blindness, heart attack, and neural issues?
So definitely, these are all complications of diabetes. So it can affect your eye, it can affect your heart, it can affect your kidney, it can affect nerves. These are all the long-term complications. The main aim of treatment of diabetes is to prevent all these complications. So you need to regularly screen your eyes for development of retinopathy once in every year or 2 years. People who already on retinopathy should be screened once in every year for retinopathy. So that retinopathy can lead to, there are many causes for blindness in diabetes. One of the causes is the retinopathy. So once in every year, they should be screened for all these complications. So there are some
Yes.
tests which are used to screen kidney involvement. For nervous system, we use a monofilament test. Just it's a bedside test. And for eye, just they should have a regular eye screening for retinopathy. So these are all we regularly recommend patients to go for regular checkup for all this prevention of
साल में
complications.
एक बार, annually once is enough
Yeah, definitely for patients who are not who didn't
for
develop
diabetes.
all once in every year, yeah, on diabetes that not who didn't develop any complications once in every year is sufficient.
Good. So this is what I understand from your अब तक जो आपने बोला है कि ये एक बार जानने से कि आपको डायबिटीज है वो बस नहीं है. You have to continue addressing issues which might crop up in future, and you have to keep your regular tests and reports ready. That's what I
Yes,
understand from what you said, and it's very
yeah.
important.
So this is
Yes,
a long-term
Doctor.
disease, so you should live. Yeah.
Yes, doctor, please continue. Very important point that you're saying.
Yeah.
It's a very long-term
So it's a lifestyle
condition.
disorder. You should live it with it. So have a good understanding of the diabetes. That is more important. Unless you understand what diabetes is, what all the complications, what's a management plan. So you will not be able to manage diabetes unless you properly understand what is happening with you and with diabetes. So definitely you
All
should
right.
have a good knowledge. Yeah.
Yeah. One more question that I want to ask from the registered users is how do you manage stress to keep diabetes under control?
See, stress is first is identification of stress itself is very difficult. So be sincere enough with your feelings. If you really have stress, just if it is a temporary one, take a break from the stress. So take social support from your family and friends. Uh, Start exercising if you're not exercising. Start a healthy diet. So these are all things which can help you in relieving stress. If it is a thing which you have to live with it, just sit and uh, to sort it out. How we can manage it properly. Proper organization and proper timing can all help you in managing the stress. And if nothing helps, just seek the help of a good psychologist or counselor. That might help in relieving of your stress. But the management of stress is very important. Yeah.
Yeah. So now
Yes.
next question is from Mishti Singha. I did not get any other further age and other details from her. But Mishti says on medication Depavel 10 once daily and Amaryl M twice daily. How do I control my sugars?
Uh, yeah, definitely. She's on probably two drugs, already on two drugs. So we don't know what her HbA1c level of how controlled her sugars are. But definitely, if it is not under control, so we need to find out the reasons for uncontrolled diabetes. If there is no strict compliance with the lifestyle modification, that should be the first thing to be answered. If everything is true, then if everything is she's compliant with, probably there needs to be a change in the treatment plan. So there are few more drugs which can be added upon. So basing on the stage of diabetes. So please consult your doctor. So let the stay what levels your sugars are in, and probably definitely if he is not under control, definitely there should be a change in treatment plan.
Yes. So I was smiling because సూర్య ప్రకాష్ రావు గారు కడప నుంచి ఒక మెసేజ్ పెట్టారు. ఆయన ముక్కలు
Okay.
ముక్కలు ముక్కలు ముక్కలుగా టైప్ పెడుతూ వస్తున్నారు అనమాట. ఫర్ లాస్ట్ ఐ బీన్ ఆస్కింగ్ హిమ్ టు టైప్ ఆల్ హిస్ క్వెరీస్ ఒకటే దానిలో పెట్టమని అడిగినా కూడా వారు ఇంతవరకు పెట్టలేదు. సో వండర్ఫుల్ టీమ్, థ్యాంక్ యూ సో మచ్ Apollo 24/7 team for gathering all these bits and pieces of information and putting them together for me. Because I request all the patients who are watching this live, while we sincerely want to address your questions, please make it easy for me and the team to put it before the expert. Surya Prakash Rao Garu is suffering from diabetes since last 4 years, and he's 45-year-old if I've seen him right. Height is 175, weight is 75. Uh, then taking two tablets currently, HbA1c is 5.8, previously 7.8. I'm also suffering from back pain on hands and fingers, numbness towards the end, getting tired. GMR 500, two tablets daily, and yeah, started joint pains also. These are those
Okay.
all bits and pieces that our team has put together.
The problem with the, I think he is not technically not
తెలుగులో
sound
చెప్తాను.
probably.
సూర్యప్రకాష్ రావు గారు మీకోసం తెలుగులో ఆన్సర్
Yeah,
చేస్తారండి.
సూర్యప్రకాష్ గారు డెఫినెట్గా మీకు మీ షుగర్ అయితే కంట్రోల్లోనే ఉందండి. ఇట్ ఈస్ వెల్ మంచి కంట్రోల్లోనే ఉంది. బట్ స్టిల్ మీకు కొన్ని మీకు బ్యాక్ పెయిన్, ఫెటిక్, జాయింట్ పెయిన్స్ ఉన్నాయంటే ప్రాబ్లీ డయాబెటీస్ దానికి కారణం అయి ఉండకపోవచ్చు. సో బెటర్ యూ కన్సల్ట్ యువర్ డాక్టర్. ఒకసారి డాక్టర్కి కలవండి. జస్ట్ లెట్ దెమ్ ఎగ్జామిన్ ఫిజికల్లీ. ఒకసారి వాళ్ళు చూస్తే కూడా దే కెన్ వన్స్ వాళ్ళు ఎగ్జామిన్ చేసి డాక్టర్ అయితే సో బికాస్ మీ షుగర్ అయితే కంట్రోల్లోనే ఉంది.
Dr. Garu, your
పైన ఉన్నారు. బట్ స్టిల్
yeah. So Mr.
some
Surya Prakash's sugars are under control, and he needs to control for the joint and backaches. He needs to consult other physicians, is what you're suggesting.
doctor because definitely needs a physical action by doctor because this sugars are well controlled. That is not explaining his problem.
All right, all right. So, broken voice, but I think we got the answer from you. Mr. Timir Das is asking, does diabetes cause balance disorder? Doctor,
So now,
freeze
okay,
ayyar
ma'am.
Madhilo, if you could start your answer again.
Sure, sure. Yeah, to maintain balance, the nervous system.
Okay, I don't think we're getting your voice well. Dr. Garu, if you can quickly refresh your link and come back, that will be helpful. Three more questions that we can, or two more questions that we can quickly take after Dr. Madhusudhan Garu comes back and joins us. One balance question that we'll take is also, uh, Dr. Garu, are you still there with us? Are you, or would you want to refresh and join us back? Okay, we'll wait for Dr. Madhusudhan Reddy Garu to join us back. In the meanwhile, I would request all the winners of Health Quiz, or last week's winners of Health Quiz, please do send in your details like phone number, email ID, and complete name by latest by Wednesday this week to marketing at apollo247.com so that your health credits can be credited. Well, we have Dr. Madhusudhan Reddy Garu back on the show. So we're talking about balance issues and diabetes.
Yes, yes. Yeah. So to maintain a good balance and intact nervous system is very important. See, there are some nerves in the body which tell our brain in what position our feet are. So these are the nerves which might get affected during diabetes. With diabetes, these
Yeah.
nerves get affected. This is a part of neuropathy. So when these nerves which maintain your balance get affected, it might cause imbalance. The second thing which might cause imbalance is your vision. Even the vision is very important. That might be the reason for your imbalance. And the other reason might be a problem with your nerve. There are some conditions which can cause imbalance in patients with diabetes. Definitely, you need to see a doctor and have a thorough checkup to find out the reason for the imbalance.
Right. So here's Sean David's question, male 65, who was already asked a question. Hypertension and diabetes affected with the macular edema. Doctors say it is due to hypertension and suggest control both hypertension and type 2 diabetes. What's your advice?
Yeah, definitely. Macular edema is one of the complications of diabetes, and mostly it is hypertension. So, macular edema is a very uh, uh, hello. Am I audible to you?
Answer. Yes,
Yeah.
yes, yes, doctor.
So macular edema, definitely you should have a good control of both hypertension and diabetes. So once you develop
Okay.
macular edema, so the only thing which can help you with a better control of diabetes and as well as hypertension.
Yeah. So one
So
quick question, last question. 62-year-old male Srinivas, if due to your stress, sugar levels go up, is there a moderate, do we need medication or only reduction of stress is important?
yeah, so definitely it's a level of sugars that is more important. So if it is in a very early stage or pre-diabetic stage, definitely relieving of stress might help in getting back to normal levels. But if there are very high sugar levels, it should be both. So definitely, if
Okay.
stress is the only factor, it can be reversed at a very early stage. But if it is a very uncontrolled sugar, there might be other contributing causes along with stress. That might relieving stress might help to control the diabetes.
Yes. So, yes, if it is an early level, you can reverse stress induced diabetes. Next question, and the last question is female, registered user, 45-year-old. After COVID, I'm suffering from diabetes, but diabetes fasting 150, random 185. Daily, I'm taking glucomet 500, but I'm not getting positive results. It's not coming down. What to do?
So please check your with your lifestyle whether there is any defect with your lifestyle, or if you are perfect with your lifestyle and diet, then probably they are under moderate control. Mild increase in a metformin dose should help you in your sugars get controlled. If these two, if your lifestyle and diet you are compliant with that, then we need to just mild increase in the metformin dose might help. Along with that, definitely your lifestyle should be changed if it is not following a good lifestyle.
Wonderful, Dr. Garu. Thank you so much. Mr. Timir Das and others are thanking you for a wonderful session and good answers. Thank you for spending
Yeah.
your Sunday
Thank
time with us. Before we leave, we want your top tips. We want to talk, your top tips to address stress and diabetes, please.
Yeah, sure. So, diabetes is a lifestyle disorder. So, medications play a very minor role in the treatment plan of the diabetes. It is mainly the lifestyle which should be modified. Unless you modify your lifestyle, the medications have a very minor role in the treatment of diabetes. And next most important thing is patient involvement. You should be well equipped, well informed about diabetes. You should know what happens with the diabetes, what are the complications, what medications you should be well known with that. And patient participation in the treatment plan is very essential. And stress is one of the behavior lifestyle disorder which might worsen diabetes or might contribute to uncontrolled diabetes. The most it can be very subtle and it can't be identified at an early stage. But if you feel that stress is the main cause, just start take a break. If you have a stressor, a temporary stressor, take a break. So if the stress continue to have stress, take the family support, take your support or social support from your friends. So maintain a good diet, well balanced diet, which should help in relieving of your stress. And exercise is one of the most important thing that might help in relieving with stress. So at least to maintain a 30-minute brisk walk a day, or if you can't do that, at least avoid a sedentary life. If you are sitting for more than 30 minutes, just have a break, have a brisk walk for 5-10 minutes, and then back to your work. So just maintain this, and a good diet should help. And meditation and yoga might help with relieving your stress. And these all techniques won't help you. Just you need to consult your doctor or a good psychologist or a counselor, which who might help you with managing your stress. So maintain a healthy lifestyle. Lifestyle is more important thing than having medications. So unless you maintain a good lifestyle, medications might not help you with the control of your diabetes.
Wonderful, Dr.
Yeah.
Garu. Thank you. Thank you. So, Dr. Garu, while you're here, I would want our audience to understand that a doctor should not induce fear and a patient should not be avoiding the doctor. It's a long term relationship
Yes.
that both, especially with
Definitely.
diabetes.
Yeah, they should have a good rapport with the doctor. They can at least they should be expressing all their concerns. Unless their concerns are left unanswered, the treatment plan never will be complete. So they'll have a lot of fears, unnecessary fears. They can be answered by very simple way of expression. Once they express it, we can definitely help them. All this play a very important role in the management of diabetes. Unless there is good patient involvement, there is no good treatment plan. So one size will not fit all. So there is no treatment plan which fits all the patients. Definitely, diabetes needs very individualized treatment. So it depends on their lifestyle, their background, cultural background. All their diet should be planned according to their cultural background, family preferences. Unless we involve the patient, definitely we can't have a good management plan for diabetes.
With that fabulous
Okay.
response. Maybe, I'm
Okay.
going to ask 3 questions of my health quiz next. And Dr. Garu, you have given clues to all my questions today. So people who have been watching, they are going to participate. Please type your
Yeah.
answers in the YouTube chat box. Thank you, Dr. Garu. Thank you so much for being with
Thank
us
you.
today.
Thank you for having me in the show. Yeah. Thank you.
Thank you.
Thank you all.
Thank you. So this is now time for you guys to answer my questions. I'm going to ask you 3 questions on the chat, on the YouTube. Please, on the chat box, please go ahead and type answers. Only on YouTube, winner's name will be selected and announced at the end of the show at the sole discretion of Apollo 24/17. And if I have taken your name to be the winner, do write back with all your contact details at marketing@apollo247.com. Gift vouchers and health credits will be shared with you. One important notice to all the winners: if I am taking your name to be the winner, you need to write back to us. If you do not write back to us, we don't know how to contact you back and give your the gifts to your account. तो चलिए आज के 3 क्वेश्चंस हम आपके सामने लगाने जा रहे हैं. On the screen you have the questions. The question number 1 for this week's health quiz is true or false में टाइप कीजिए. Stress induced diabetes is reversible. Is this true or false? Stress induced diabetes is reversible. True or false? Question number 2, fill in the blank. Majority of people diagnosed with diabetes have which type of diabetes? Type blank. Type 1 or 2, please type in there. Majority of the people diagnosed with diabetes have which type of diabetes? Type blank. Yes or no? Third question. Name the instrument used for measuring glucose levels in the blood. Name the instrument used for measuring glucose levels in the blood. These are the 3 questions. Please keep getting your answers. Type your answers in the chat box. In the meanwhile, we are giving away gift vouchers. Here are the gift vouchers for this week. Next slide, please. If you want to consult top doctors from Apollo Hospital, do so with Apollo 24/7. Online doctor consultation पे आप पा सकते हैं 150 rupees का cashback. Use the code AskDoc150. And the next coupon is we are going to give you code first 3 use कीजिए on Apollo 24/7 to get 25% off on online medicine orders and up to 2 hours delivery भी है. And HH247 is the next coupon code that we're giving away exclusively for our health our viewers. Get up to 199 off on online consultation with Apollo doctors and up to 20% off on online medicine orders. Use the code HH247. Now you know that you can also order medicines or book tests through WhatsApp. Now you can do a text or call 09355 247 247. The number is on the screen. You can avail healthcare services just like the app. You can use WhatsApp as well. And next week, by the way, we are all talking about a very, very important topic which we have never covered on Health Hour. We're going to talk about tuberculosis, TB के बारे में हम बात करने वाले हैं. How can we fully cure it? How do we address tuberculosis with the multi-drug resistance which is on the block, which is a big debate that is happening around? Let's talk about tuberculosis and management. And here are the winners for this week. Congratulations, Sean David, Vishal Mahala and Jolly Singh. Repeating, Sean David, Vishal Mahala and Jolly Singh. Write back with your name, contact details and email ID to our team marketing at apollo247.com. Thank you all. We shall see you next week. It was a wonderful discussion with you all participating. Namaskar.